There you go. Welcome, everybody. Thank you for watching our recording, either at home or live. We have Dr. Jessica Gass on our little program this evening, and she's going to be talking about sort of injury prevention and specifics of different areas. I'm going to just throw it over to her. She knows way the hell more about this stuff than I do. And with that, Dr. Gass, it's all yours.
Wonderful. Let's get started tonight. We're going to be talking about the hip and the foot. It's common to have aches and pains and tightnesses and weaknesses there that can even cause issues with the monkey in the middle, which is the knee for us runners. So on the next slide, Coach David here, I'll just introduce myself. I am Dr. Jessica Gass. I'm a physical therapist, doctor physical therapy. I own a clinic here in Encino, Doctor of Human Movement, and we'll be talking about injury prevention tonight. Let's go to the next slide, which is common injuries. If you guys know how to like raise your hand on Zoom, or if you're watching the recording, raise your hand if you've had any of these issues in the hip. We got piriformis syndrome, hip impingement, bursitis, IT band issues, arthritis, hip flexor strains. I'm seeing some hands there. Quad hamstring strains, yes, that they happen. On the second column here, we have common foot issues like plantar fasciitis, Achilles tendonitis, shin splints, gastroc soleus or calf strains, posterior tibialis strains, peroneal tendonitis, and always we want to include with marathon training, stress reactions or fractures are possible. And let's see, the next slide includes things that can happen in the middle, the knee pain issues. If the hip and the foot aren't intact here, sometimes you can develop kneecap pain, quadricep patellar tendonitis, which is commonly known as jumper's knee. We got meniscus pathologies that can happen, which is the cushion in between the knee that can get frayed a little bit if we irritate it. We got quad strains and again, stress reactions that can happen in the knee if we're not moving properly. So tonight we're going to be covering flexibility and strength things for the hip and the foot. The next slide is a video. If we see that, you can look into your running mechanics. And in this picture in particular, you can see collapsing in the hip. So if your hip collapses, that horizontal line across your pelvis can drop, and that causes extra strain down the chain. So that's where, yes, David, thank you for pointing that out. Yes, that can happen, and it can cause collapsing down into the thigh as well. So we're going to try to detect this for you guys. This will be a little bit of a workshop. You'll be standing up and doing some of these movements with me so that you can detect these things for yourself and know what you have to work on as you go throughout your marathon training. So let's go to the...
Shall I play the slide?
Sure, absolutely. You can see the running analysis in motion. So with a thorough running assessment, this measures all your joint angles during every phase of running. It detects how much you're collapsing or overstriding or bouncing, and making sure that you know exactly what you need to do to improve your efficiency and decrease your risk of injuries. In this video in particular, there's a lot of collapsing happening and a lot of heel striking, overstriding. So we can detect those things and cue you with some drills on what to do. And the next slide are the movements we can follow up with our running assessment. So first movement for everybody, if you're comfortable right now, what you're going to do is stand up and we're going to reach for our toes, okay? So if you can reach for your toes, you should be able to touch your toes with your knees straight. So with your knees locked straight, you want to bend down and try to touch your toes. If you are unable to touch your toes, you have some tightnesses in your posterior chain, like your hamstring, that might need to be worked with some hamstring stretches. One of my favorite hamstring stretches is laying down with a strap around your foot. So I'm going to demonstrate that. If you have a strap like this, like a belt or a leash or a sheet, anything that you can wrap around your foot, you can lay in bed and pull it up for a nice stretch in the back of your leg. So this should help eventually for you to touch your toes. You want to hold that stretch for about 30 seconds to address any hamstring tightness. This is also treatment for sciatica. So if you have tightness down the leg, then you can stretch with a strap as well for that. The next movement I want to do with you guys is we're going to skip over to the single leg balance. This one's for the foot. So if you can stand on one foot and lift the other leg in the air and hold with your eyes closed. We're going to do this for 10 seconds, okay? So if you can stand on one foot and hold for 10 seconds, I'll count out loud. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. If you had to fall over and catch yourself, then we might need to work on balance, which includes and involves all the intrinsic stability muscles of your foot. So if you were catching yourself with your other foot or having to hold on to something, then there's some wobbliness happening there in your leg, and we need to improve the stability. Balance is the treatment for that. So if you want to stand on one foot when you're brushing your teeth, waiting for your coffee to brew, anything during your day that you're just waiting in line, that can be a good moment to practice this and improve your stability. Running is a single leg sport. So when you're on one foot, running is a controlled fall, stabilizing yourself on one foot at a time. So the more stable your foot is, the less likelihood you'll develop things like plantar fasciitis or the tendinitises that reach down into the foot. Next movement we're going to do together is a single leg sit to stand on that second row there. So single leg sit to stand. If you guys are sitting in a chair and you're safe to do so, I want you to sit down with one leg up in the air. So if one leg's up in the air, you should be able to stand up and sit down 7 times, okay? So I'll do it with you guys. Let's sit in your chair, give yourself some space. And we're going to stand up on our right leg 7 times. Let's try this. Are you ready? Let's go. 1, 2, 3, 4, 5, 2 more, 6, and 7. What I love about this exam is you're not only testing if you can use your strength in your legs to complete the movement, but you can also be aware of your alignment. So if you're noticing as you stand up that you're super wobbly or your knees are coming together and you're having to connect your legs together for stability or balance, or let's say you're collapsing inwards, you can see those mechanics in this movement which apply to running. So if you can practice this movement and make this super strong, then running will feel that much easier to do. So what I like to do is be in front of a mirror for this, and you can see the alignment of your hip, knee, and ankle, and make sure that they stay stacked instead of caved in. Any questions about that so far? Any hands up? Any hands up on who could do it?
Well, let's do the other leg.
All right, let's do the other leg. So we just did the right, let's do the left. So you're going to be sitting on your left leg, right leg up in the air, and let's begin. 1, 2, 3. And what I'm looking for is the alignment. 4, 5, 6, 7, 8. Oh, it was only 7. All we need is 7. Good job. So if you could do 7, you passed the test. Good job. If you felt wobbly, I would take mental note that that would be a great exercise to strengthen your legs, single leg strength for running. All right. The next movement here for the hip strength is a one leg bridge. I'm going to demonstrate. And if you're in a place in your home that you feel safe to do so, feel free to lay on the ground or on a yoga mat. We're going to do a one leg bridge, and this is for strength in your glutes. So this is what it looks like. With one leg in the air, you're going to lift your hips and hold for 10 seconds. So you're squeezing your glutes, holding for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. If you feel like you had to drop, if you feel like you were twisted, then that's a sign of possible glute weakness that we want to help strengthen. You want to do this on both sides. So as David requested, let's do the other side as well. I'm going to go ahead and lift my right foot in the air now. And we're going to lift for 10 seconds. If you'd like to do it along with me, I'll count out loud. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Very good. If you could stay nice and high, that's a great sign that you have good core and glute strength that will support you for your running. Any thoughts on that? Any questions from anybody? Was it difficult or any concerns?
Are you wearing a mic? How come you're as good? Yeah, I can hear you as good on the table as in the front of the computer.
Oh, good. I'm making sure I talk loud enough. I don't have a mic on right now, but I'm making sure to talk loud and clear for you guys. I'm glad you could hear me well. That's great. All right, the next movement exercise we're going to do is the side plank. And the reason why I love the side plank is because it gives you not only just like frontal core stability. A lot of people think of core strength as like the six-pack muscles, but this gets the muscles on the sides, your obliques and your gluteus medius. Those are the stability muscles that protect you with when you're running, not to like run side to side, but to be nice and stable. So side plank is on the elbow. We're going to do a full side plank on the elbow and the ankles like this. If you find yourself dropping, that's a sign of some weakness. So we're going to try to hold this up nice and high with a straight line between your chest, core, and ankles for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good job. For those who want to balance out, I'll switch over to the other side. Ready? All right, let's begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. If you found yourself drooping or struggling, I want you to take note of this exercise and start incorporating it into your strengthening exercises a couple times a week. That was a good hip strengthening and stability circuit there. We're going to move on to the ankle and foot next before we go into more details after this slide. So the next one we're going to do is a calf raise. For a calf raise, we want to make sure we get full height even on one leg. So the way we determine that is you're going to do a 2-leg heel raise first and see how high you're able to lift your heels off the ground. If you need to hold on to something, you can, and you're just going to see how high you get with both legs. After you do both legs, we're going to pick up one leg off the ground to see if you can go just as high on one leg. So I'm going to move my camera over so you can see me on the floor. So I'm going to go up with both legs and see how high that is, and then lift one up and see if you can get the same height 10 times. All right, let's do it together. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. If you felt like you were starting to just get partial ranges instead of the full height, I want you to take note of which foot that was, and then we'll do the other side too. Are you guys ready to do the other side? I just did my right leg, so now I'm going to do my left. Let's see. Good angle. All right, on my left foot, we're doing 10 rounds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. If you had a hard time getting full height, that is a possibility for calf weakness. Calf weakness is very important for runners because we need to make sure they're nice and strong for the push off. If you're not as strong in your calf for push off, then there might be some overstretching and straining of other areas in your foot, like the tendons, the supporting tendons, or the plantar fascia. I commonly get patients with plantar fasciitis that have weak calves and they're not supporting their foot as much as ideal. So keep that in mind. There are some other movements here in the foot, which we will get to on future slides. So let's go ahead and move on to the next slide, Coach David. Mm-hmm. And we already did the toe touch for hamstrings, but I have a good stretch next for quad tightness. So who here, show of hands or little clappy hands, if you have quad tightness or you feel like the front of your thigh is tight after your runs or before your runs as you're running? Anybody? I've had a quad strain myself when I was in college. Yes. So here's the test for quad length. We want to make sure they're nice and mobile for good extension when you run. If you can't bring your leg back far enough when you run, it might be because this muscle here is too tight. So this is what the test looks like. You want to lay on your couch or bed, and you want to hang one leg off the side. So I am hugging one leg and letting the other one dangle off the side of the bed or the couch. We want the leg to be level with the couch and your foot to be dangling straight to the floor. If your leg is dangling way up here, that's a sign that you have hip flexor tightness. Or if your foot is kicked out straight because it doesn't want to dangle down to the floor straight down, then that's a sign that your quad is too tight. So I want you to try that off the side of your bed, guys, or maybe off the side of your couch. And if your knee is hanging way high up above the level of the couch, or if your foot is straightening out and your knee is pretty straight, then that's a sign that your quad muscle is tight, and we want to incorporate some quad stretches for this. I'm going to show you guys a nice quad stretch you can do if this seems to be too tight. It involves using the same stretching strap that we did for the hamstring. So you can use a belt or a leash, and I'm going to hook it to my foot and pull it back for a nice stretch. All right, so as you can see, I'm holding the strap and I'm pulling my foot back behind me as far as is comfortable. And you want to find a nice relaxed position for about 30 seconds after your run. If it's super tight, you can hold for a full minute just to help lengthen this muscle so that you're able to do a longer stride. And when you're running, your leg will be able to go further back behind you. All right. Make sense, everybody? Yeah? Doing good? All right. The next bullet point here is figure 4 stretch. So this is a hip mobility stretch. I like to do this one when I'm at work, just sitting in a chair. So if you're an office worker and you're sitting in a chair a lot, this thing can sometimes get pretty tight. So if you're sitting down, you can cross your foot over and lean forward with your belly button. This will stretch your hip joint into external rotation. It gets that deep hip glute muscle, and that muscle is actually what the sciatic nerve goes through, which goes down your leg. So you want to make sure you keep this nice and loose. If your knee is way up here, that's a sign that your hip joint is very tight. So you want to try to either push the knee down gently to your tolerance and hold for about 30 seconds, or think about bending forward from your belly button instead of like rounding and hunching your back. You want to think about keeping a neutral spine and bringing that belly button forward till you feel a nice stretch and hold. Let's try the other side too and see if the other side is equal. If the knee is higher, then that means we need to stretch that side more often. So we're going to lean forward and hold just to stretch that hip. This stretch can also be done laying on the ground, pulling your leg up in that figure 4 position. Sometimes after our long runs, I like to do this one like in a squatted position. It requires a lot of balance though. I've seen some of you do it before. Good. How do you guys like those stretches? We got the hamstrings, which is the back of the leg. We have the quad stretch where you hung your leg off the side of your bed. And the last one is the figure four. Cool. Oh, I see a little cheer. Nice. Thank you, guys. Great. Coach David looks like he just stepped out of the room real quick.
Okay, sorry. We're looking for my dog.
Oh,
there you go.
Next slide there. Yes. So that's just a visual depiction of the exercises we already did. So we did a single leg bridge for the glute strength. We did a side plank for the glute med and core stability. We also did that single leg sit to stand, which you should be able to do 7 times of. So that's just another reference there. Now, the next slide, we are transitioning to the foot a little more here. I have a picture on the next slide of a runner who is overpronating. Can you guys see the difference there between the 2 feet and how they're landing on the ground? So the picture on the left is more of a neutral impact where the shoe is not caved in. But then it looks like the shoe on the right looks like more of a green shoe there. It is really caved in, and you can see the inside of the ankle a lot more. It's shifted in towards midline. Yes, exactly where the mouse is right now. So there is a level of acceptance for pronation, but there's also if you overpronate, it can be controversial here. So it basically puts the whole leg in a twisted position and can cause some torsional twisted forces all the way up the leg. And this can cause like meniscus issues in the knee. It can cause Achilles tendonitis in the ankle or plantar fasciitis or IT band syndrome even. It goes all the way up the leg. So there's another picture on the next slide with more of like a drawing of what that is to make it more clear. On the left is the unsafe overpronation. The second picture is just typical adequate pronation. It's absorbing some forces, but not overpronating. The middle picture there is just a neutral ankle. So the reason why I wanted to show images here is because I always get runners asking me, what is pronation? Is that even a good thing? Is that something I should be trying for or avoiding? And it is a very, very common question. So you guys are not alone. So we want to absorb some forces in the arch, but if we over collapse inwards, then it can cause some overstretching and torsional forces. So anyway, the next few exercises are going to be to strengthen the foot. So I have pictures here because I didn't know if you wanted to see my feet or not. So here's some pictures. If you want to take off your socks and shoes, feel free. We're not looking. You have your camera off if you'd like. But we're going to go through some what I call toe yoga or smart foot movements. They're to engage the muscles, intrinsic muscles of your foot to help keep your foot in a more stable position to prevent over collapsing or over pronation. So the top one is a toe splay, and I feel like this one is more natural for people. So you're just going to try to spread your toes out nice and wide. And if you're able to do so, great. Take a little mental check mark there. Good job. It's engaging all the muscles that separate your toes. The next movement's a little bit harder, which is trying to lift just your big toe. If you can lift just your big toe, you're engaging the extensor hallux muscle. It's one of the muscles of your feet, kind of warming that big toe up. But then the last movement at the bottom of the screen here is trying to bring the big toe in, which is the hardest of all. I have had plantar fasciitis patients in my clinic here, and they don't have necessarily the smartest foot. So we're trying to cue this movement to engage the muscle that supports the arch. If you're able to bring that big toe in, it's engaging the muscle that literally goes across your arch. If you can't do so, which sometimes is difficult, sometimes that neuro connection in your brain doesn't quite get it, hasn't been taught this movement before. We're not really taught this movement as kids, so it can totally be understandable. But if you need to assist your toe, you can actually use your hand to bring your big toe in and try to hold it there as long as possible and then relax. So if you're struggling with things like plantar fasciitis, this could be a valuable movement to practice and to train when you're just sitting at home after work. So try that out for yourself. It's a great new muscle that you can tap into to give yourself some extra stability in your foot. All right. The next slide here. Oh, it looks like we already did this one too. The The calf raise movement we already did. Did we do the knee to wall already? I'm not sure if we did the knee to wall yet.
No, not yet. Not yet.
Oh, so the knee to wall movement is a common ankle mobility test I do to see if you have ankle stiffness. Some people say their ankles feel very, very stiff. And if your ankles aren't absorbing some force, then sometimes it is distributed somewhere else, causing some pain. So this picture depicts the knee to wall test. We want to be able to scoot your foot about 10 centimeters away from the wall, which is about the width of your hand. So if you don't have a tape measure with you, I want you to place your hand between your toes and the wall for that space there in the picture. So if you place it here, I'll demonstrate as well, similar to when we did the heel raise. So I'm going to place my foot close to the wall, and then I'm going to place my hand between the wall and my foot. So we want to have about that much space between the wall and your foot. And then I'm going to scoot my camera away so you can see all the way up to my knee. And you want to be able to lean forward to touch your knee to the wall. So I was able to touch my knee, which is a good sign that my ankle can move as much as it needs to absorb forces as you run. If you feel like you can't touch the wall without lifting your heel, you want to be able to keep your heel down. But if you're lifting your heel to touch, that is a cheat. So we want to make sure you keep your heel drive down to the floor as you lean forward to touch your knee. The other foot could be wherever you'd like. I get questions about that all the time, but the other foot can be wherever you'd like. You can be in a lunge position or you could be standing tall. It's up to you. And try the other side as well. If you place your foot about a hand's width away from the wall and try to touch your knee to the wall, you should be able to touch. If you cannot touch, then that's a sign that you have some stiffness, and that stiffness could be coming from your ankle or the calf. And there's ways we can address either one of them. The easiest one is to stretch your calves. So I like to do a calf stretch. Most of you know this one already, but you push against the wall and have one leg back. So I'm going to place my computer down so you can see me. I'm just driving my heel down and I'm stretching this part of my lower leg. So I'm lunging forward with my hands against the wall and driving that heel down. You can also get the Achilles by bending the back knee a little bit. If you bend the back knee, you'll feel a stretch closer to the Achilles, but if you straighten that back knee, you'll feel a stretch more in the gastroc, big belly muscle. All right. Any questions on that test? Anybody struggle with ankle mobility and have questions? Let's see. I'll check the chat box. Okay, someone asked about the yoga strap. Yeah, you can use a Pilates or yoga strap for those stretches earlier. Yep, and I can also send the runner readiness assessment to you guys. Awesome. Any other question? Okay. I see a question up above that says 7 times for this sit to stand. Yes. 7 times. Wonderful. Okay. So that is all the hip and ankle stretches and strengthening exercises that I commonly give all my patients. The next slide is just my contact info. If you'd like to press next there, Coach David.
Whoop, there we go.
Wonderful. So if you want to stay connected with me, you can follow my Instagram. I also have contact information on that QR code as well. Those are services I offer for runners. If you're interested, I'm here to help you guys get through this marathon as a resource. I offer a discount to LA Road Runners too. So just use that code on my website if you want a discount to help you get through to your goals. I'm going to open the floor now to questions. Anything regarding the hip and ankle or the monkey in the middle?
Just so you guys know, if you scroll your cursor across the screen, the little command bar will open up. You can click on audio, and that little red line that goes through your what looks like an antique microphone will turn off, and you'll be able to talk. Or you could click on the chat and type something in the chat bar. Just so no one feels bad, I pretty much flunked everything there, so I need all of that. I Yeah. So there is that.
Yeah, we oftentimes don't even know where we stand until we test ourselves. So it's good to be aware of things that you can work on and help prevent injuries throughout your training.
Yeah. I need a lot of strength training, that's for certain. I need everything, but there you go.
I see David has his hand up. David, are you able to unmute yourself and ask?
Yes.
Okay.
How does this assessment work for power walkers? How
Ooh.
how different is it?
Ooh, good question. So, the main difference between walking and running, from my perspective, is running entails a brief moment in time where you're only on one foot. Whereas walking, you're on. There's a moment in time when you're on 2 feet at the same time. Normally, running, you're on one foot more often. So, walking tends to be more close to the ground because your feet are on the ground for longer periods of time. You still need to have good foot strength and good hip strength to prevent collapsing mechanics as you walk, though. I have had walkers come in here or call my clinic, and they're asking for gait assessments only for walking instead of running. And I have seen very similar collapsing patterns in walking as well. So you want to make sure that you have good, strong hips, like the bridge and the side plank position would be just as applicable to you, as well as the pronation. Some walkers also really kind of cave in with their feet, and that can cause the same torsional forces as runners. But runners have more, actually 3 times your body weight is going through your leg at one time, whereas walking is about only 1 to 2 times your body weight going through your leg at one time. So there are more loads to absorb, and more strength is required to keep a stable position when you're running as opposed to walking. Does that answer your question?
Yes. Why is it my brain can only command my toes to wiggle? That's all.
Ooh,
That's all I can do. Can't do
yes.
individual.
Good question. So, there is a neuro pathway from your brain, parts of your brain to every muscle in your body. And we have a huge area in our brain to control our hands because it's fine motor skills. We require a lot of awareness of all the little muscles in our hands, but we don't have as much of a area in our brain controlling our toes because they're oftentimes stuck in a shoe. So we don't have the neuro connection to control all the movements of our foot. And it's good to train that with barefoot positionings and what we call the toe yoga tonight. So feel free to practice that more often at home. When you're done with your day, take off your shoes and try to control those little movements like bringing your toe in and things like that. It'll help engage the muscles and help your stability from the ground up.
So I can use my hand to teach
Yes.
my brain to wiggle the big toe only, yeah, or to splade the big toe.
Exactly. You can use your hand to assist and then slowly try to let go your hand and see if your foot can hold. When you're holding that position, when your hand lets go, you're getting that muscle a little tired. And the fatigue that you're feeling is the brain acknowledging that muscle, and it will slowly and slowly learn how to just engage it by itself without the assistance for that hold. So it's a progression.
Oh, great, great.
Mhm.
How come I'm slapping my stride slaps on the heel? I'm not walking on my toes. It's the I hear my shoes slapping on the heel
Mhm.
on the
Mhm.
pavement.
So if you're slapping the pavement really hard, that's a sign of um, what we need to work on is deceleration drills. You can actually teach your body to land softer and quieter. You can try to walk like a cat across even your home, just trying to walk nice and quiet, slowly and quietly, and that's your body trying to slow yourself down and engage those muscles. What we call eccentric control. So it's kind of like when you're doing a bicep curl, you're learning how to slowly lower your arm. You have to learn how to slowly lower your leg as well. Does that make sense?
Yes, indeed. Thank you.
Mm-hmm. Great questions.
Some good questions. I have Ashley asks, do you have recommendations for adductor groin pain?
Ooh, that is a great question. So if you have discomfort on the inside of your thigh, adductor groin pain. So this muscle, actually, I have a muscle poster. So this is my muscle poster. If you have pain on the inside of your leg, that's the adductor muscle. Sometimes there are two things that it could be. It could be too tight, and a way you can test that is with a side lunge position. So if you are standing, you can shift your weight to the side and feel that stretch. You want to hold that stretch for a nice 30 seconds gently to lengthen that muscle. But if that isn't difficult at all, it could be a strength issue. And I'll show you an exercise you can do for strength here on my table. So if you have an inner thigh groin muscle strain or pain, you can try laying on your bed and bringing your top leg in front, lifting your bottom leg. This is helping to strengthen the muscles on the inner thigh. And then we can progress that over time. If that's too easy, there's actually an exercise called Copenhagen that I love to give patients. I have a post on my Instagram on this too. Ashley, if you want to shoot me a message on Instagram, I can give you that post for reference later on. But let me show you guys the exercise here if you'd like to try it on your own. So it's called Copenhagen. I use a chair for this, and it's a side plank position. So if you guys can see me here, you would put the top leg up on a chair, and this is a harder exercise. So do this at your own risk, but you're going to lift up onto your own elbow into a plank position and then try to lift your bottom leg. So I have my knee on the chair to make it easier, but if you get better at it, you can even scoot away and you're using the inner thigh. So it's difficult, but give it a shot, Ashley, and shoot me a message and I can chat more with you about that. Does that answer your question? Any
Ashley
questions?
says, will do, and thank you.
Oh, yay, great. Enjoy.
Yeah, good stuff. Anybody else? Any questions for Dr. Jessica? Y'all should know that occasionally Dr. Jessica comes out to our Balboa group in Encino on Sundays. And for those of you who don't know, she's actually a really fast runner. She led our 1:30 pace group, the official pace group for the Malibu Moves half marathon a couple of weeks ago. 1:30 half marathon finish time, gang. Um,
Oh, thank
and
you.
also, didn't you do like New York at some phenomenal finish time? Or
Oh, great. Yeah, I was able to do Boston this year with a 3:30
Boston?
time. Yes, it was a wonderful experience. My family was there to cheer me on, and they actually started running and they were inspired from that race. So one of the bigger wins is not only my time, but the fact that I inspired my family to start running too.
Oh, that's great. What was your finish time? I forgot. I didn't hear.
Uh, I got a 3 flat at Boston Marathon.
3 hours flat in Boston. Good
Yeah,
grief. Yeah,
thank you, coach.
I want to be able to do that when I grow up. It's yeah. Okay.
Oh,
Anyway,
this
that
is wonderful. I love being amongst the entire road running family community. So thank you all for having me tonight. And if you guys have further questions, you can shoot me a message on Instagram, Dr. MVMT. Shoot me an email, Jessica at drmvmt.com. Feel free to scan that QR code for any other forms of contact as well. I appreciate having you guys tonight, and I hope you stay dry.
Mel
Yes.
says superb exclamation point. Mel is one of our new members who also does like sub 3 hour. Paul says,
Whoa, congrats, Mel.
yeah. Paul says, thank you. Great exclamation point. Teresa, thank you. And smiley face. Ashley, thank you. Exclamation point, exclamation point.
Woo.
All good. Thanks, everybody.
Yeah.
Those of you who are on live, stay on. I will answer any further questions. I'm going to turn off the recording. So, those at home, I guess we will say goodbye to those of you watching the recording thing. But does anyone have any last questions going once, going twice, going three times? Questions? Good. In that case, I'm going to turn off the recording And I thank Dr. Jessica so much for coming out today or being on our chat today and giving a really thorough assessment,
Thank you
for
guys.
everybody.
Yes, it's great to see you guys too.
Thank you all. And with that, as soon as I figure out, here we go. I thank you all for watching the recorded version. And for you watching the recorded version, good night. Take care, everybody. And everybody else, stay on. Bye.